Hello and welcome to this FERNE presentation. We will be discussing today seizure and status epilepticus patient guidelines, presenting a simple clinical pathway. My name is Edward Sloan. I'm an emergency physician in Chicago. This information was most recently presented at the 10th World Congress in Emergency Medicine in November of 2022. I'm Professor Emeritus at the Department of Emergency Medicine at the University of Illinois at Chicago in Chicago, Illinois, and I'm Medical Director for the Physician Assistant Studies Program at Dominican University in River Forest, Illinois. I serve as the Medical Director for New Rose Healthcare Management at Roseland Community Hospital, a safety net hospital in Chicago, Illinois. My thanks to the 10th World Congress and mi amigo Carlos Garcia Rosas. He is a great man and a force in emergency medicine. And thank you, all of you who are watching and participating in this educational endeavor. I have no financial conflicts. I serve as the FERNE President and Board Chair, FERNE, the Foundation for Education and Research in Neurological Emergencies, FERNE.org. More about FERNE later. Background to our discussion of the management of patients with seizures and status epilepticus. In 1994, in JAMA, the Epilepsy Foundation of America provided treatment of status epilepticus guidelines. 22 years later, in 2016, the EFA guidelines are revised for the first time. And then today's presentation will discuss the following: the 2016 American Epilepsy Society Guidelines, the 2014 ACEP Clinical Policy, and the 2020 AES Treatment of Refractory Convulsive Status Epilepticus monograph. So our learning objectives. We will review the American Epilepsy Society Guideline for the treatment of convulsive status epilepticus. We will understand and discuss the ACEP Clinical Policy for ED seizure patient management, and we will update our status epilepticus treatment based on the AES Treatment Convulsive Status Epilepticus publication. An environmental assessment. In the medical literature, there are actually relatively limited number of relevant clinical trials that guide our treatment of patients with status epilepticus. There are few valid clinical trials establishing clinical efficacy of one specific anti-epileptic drug over another. Case series do exist that give us some guidance, and our clinical policies provide for us options as treating physicians. Regarding guidelines, there actually are few US or EU guidelines. The AES or EFA guideline has been the industry standard for status epilepticus treatment as a protocol for decades. The AES treatment of convulsive status epilepticus addressed in 2016 and 2020 are optimal treatment strategies, and the ACEP clinical policy addresses specific questions related to seizure and status epilepticus patient management and was last revised in 2014. Thank you for taking the time to learn more about the treatment of patients with seizures and status epilepticus. For more information, please go to the FERNE.org website. And also, please subscribe to the @FERNE.org YouTube channel. We encourage you to go to all of our social media sites to obtain or to learn what are the most current optimal therapies for the treatment of patients with any neurological illnesses, injuries, and/or emergencies. FERNE.org. If you have any comments or questions, don't hesitate to email us at FERNE.org@gmail.com. I'd like to thank you, and Ken Moore, listed here on the left, also thanks you for your time and efforts on behalf of patients with emergency illnesses and injuries related to neurological diseases. Once again, Edward Sloan, thank you.